These are the three darkest truths that people don't tell you about before entering nursing, or for example, pediatric nursing in my scenario. Number one was the amount of babies you're gonna hear cry. And when I say amount, it's gonna be a lot. Like, if you get a placement in the neonatal intensive care unit, you will hear so many babies cry, but over time, you adapt to the environment and you feel like, okay, baby's crying, it's not gonna disrupt your, focus zone and stuff. It'll be part of your focus zone. Number two is when people start nursing and no one tells them there's gonna be an assignment overload and you're gonna have to sacrifice your time with your family sometimes and literally focus your head down on the assignment from A to Z because you want that pass, you want that best grade, or you want that pass, which is meaning that you have to limit your tasks outside of life. Like if you're let's say gonna go clubbing, or if you're gonna go out with your friends, you have to cut that down and stuff, or limit it. What I'm saying is limit it and make sure you're prioritizing the things that you need to be ready for the next day or for the next semester. So that's another thing in nursing that they don't tell you about, is you are gonna lose a lot of time out on your social life sometimes, but it's manageable and things will be okay. But the third thing is dealing with deaths, patients dying and stuff, and you feel like nursing is sometimes a career which is where we save people and everyone is saved. However, at the same time, you have to deal with death, and they don't tell you that sometimes you are going to be that student nurse, part of looking after someone that's on their bereavement or end of life, and you have to ensure that you stay strong mentally and also physically, because if you eat the right foods and stuff, and if you're eating on time, it can help develop and increase your knowledge and your brain power to look after yourself and look after someone else. Because at the end of the day, if you've not had experience in caring for a dying patient, then it's gonna be crazy, because that's what nursing's about: educational or practice-based learning, meaning they will be teaching you in placements. You will have supervisors and assessors, and you will have a whole medical team around you, but you just gotta make sure that you're aware of these things, that these things happen. This is life. Like, sadly, we can save or give our 100% to save that person, and if they're not saved, it's sad. It's very sad, and you have to be aware to be strong and be another person's rock in that sense. So the family member, if they're in the room and the patient's died and stuff, you have to be the rock for them, because that's their whole that's their whole life. They lived with that person, or they've if it's their child or son, brother, it could be someone's mom, grandparents, and if the family members lived with them for that long, and you have to be so strong enough to cope with your emotions, and then kind of tell them hey, it's okay, and give them water, make sure if they need a hug, just give them a hug, offer them anything, offer them a place to sit, talk, because that's what nursing is about, to be honest. It's we feel like, or we get portrayed this mirror that it's all clinical based, but there's a lot of communication and highly effective communication behind this, and it's nothing to be worried about if you're panicking, how do I communicate, because that comes over time. Every day you communicate and you learn something better. Communication is a skill where if you're not good at it today, you will be good at it tomorrow, the day after tomorrow. So it's an everyday learning skill. Even me right now, as I'm making this video, I might not be the best communicator in this video, but it's something we're going to develop our skills on. And you have to do that as a student nurse or in nursing, generally anyways. So make sure you're aware of being a good communicator with families and children if you're doing pediatric nursing, or an adult patient if you're doing adult nursing. So be aware of this. Thank you so much.